Roger Staubach.
Throughout the 1970s, he and his passing reigned supreme throughout the NFL. You name the superlative, Captain Comeback, Captain America, Roger Staubach was simply the best. But years later, even number 12 couldn't outrun his nagging back pain.
It was kind of a constant pain, you know. It was one of those where you couldn't, you could deal with it. You kind of get used to it. I could deal with it, but it wasn't fun. You sure don't want it to get it to where it just is destroyed, and then you're really makes it more difficult because it was starting to go down my legs and things. And
so Roger had lumbar spinal stenosis, and as a result of that, it compressed the nerves in his spinal column, producing varying pain down the leg, and as a result also alters the way patients walk, and it slows down their walking ability.
I like the idea of having a neurosurgeon in the back. I think orthopedic surgeons are fantastic also, and they, you know, their knees, and I've had orthopedic really help both shoulders, my knee, hit a meniscus tear. But in your back, someone recommended you ought to have a couple people look at it, and David is a neurosurgeon, and so I met him, and he you know, really was patient friendly and seemed like he knew what he was talking about.
After reviewing his case, Dr. Barnett told Staubach if he wanted lasting relief, he needed surgery.
It's an operation called a laminectomy. The operation itself has been around for years. The big difference is that now, as opposed to 30, 40 years ago, or even 10, 20 years ago, we can make a very small incision, and through that small incision and working through a small tube in the microscope, we can actually get into the spinal canal, clean up that plaque, open that channel up so there's plenty of room for the nerves, take the pressure off of them, and be done.
Staubach went home the same day Dr. Barnett operated. The
operation really helped, and my back isn't perfect, but that area of my back, I don't have that pain anymore. I can jump, I can do things I couldn't do before, and I don't feel it.
I realize everybody's a little different. Everybody has a little different life out there, but I also recognize that everybody is special.
Anybody that said, asked me where I had my surgery, and I said, well, Dr. Barnett over Baylor, and they all knew him and said, hey, he's right up there with the best.